Hi everyone, welcome to the Academy of Online Radiology Education. My name is Sabrina Hsiao, and I'm going to be going over a study related to the gastrointestinal system. The title of this presentation is Advancing Hepatocellular Carcinoma Detection, Integrating Imaging Criteria. To start, we're going to review some important background information. So hepatitis C virus, also known as HCV, is a major cause of chronic liver disease and hepatocellular carcinoma, also known as HCC. Now, even if a patient with chronic hepatitis C does not develop cirrhosis, they're still at risk. And studies have shown that non-cirrhotic CHC patients face about a 1.35 to 1.6% risk of developing HCC over 5 years. And significantly, even when we successfully cure HCV with antiviral therapy, that risk is not completely eliminated, especially in patients without cirrhosis. Thus, these patients still remain vulnerable. As such, we have to question, how do we diagnose HCC in these high-risk groups? Current guidelines recommend an imaging-based diagnosis using both CT or MRI, particularly in high-risk patients. In these cases, a biopsy is not required if the imaging is sufficient and convincing enough. And that's where LI-RADS comes in, which is a standardized system for interpretation of liver imaging. Specifically, if a lesion is categorized as LR5, meaning it's definitely HCC, LI-RADS supports making that diagnosis without a biopsy in appropriate patients. However, the issue here is that these guidelines are well established for cirrhotic patients or those with hepatitis. However, we have to question what happens for patients with non-cirrhotic HCV, and that's what this study aims to address. Further going into the issue that the paper aims to address, the current limitation is LI-RADS imaging criteria for diagnosing HCC has not been validated in patients with non-cirrhotic HCV infection. So there lies uncertainty here whether non-cirrhotic CHC patients can be reliably diagnosed with HCC based solely on imaging, namely in the LR5 category. Moving into the methods, the objective was to assess the diagnostic performance of LI-RADS 5 in non-cirrhotic CHC using CT and MRI. So the main comparison here was non-cirrhotic CHC versus CHC with cirrhosis. And keeping that in mind, moving into the design of the study, this was a retrospective study across 4 hospitals in South Korea. And the standardized methods applied here was using the fibrosis staging, which was the Medivir classification, which really focused on stage and grading for fibrosis and the clinical correlation with that. And in regards to the second method applied was the cirrhosis diagnosis, and analyzing that pathology, clinical, radiological, endoscopic, and lab criteria were considered in this method. And ultimately, this included contrast-enhanced CT and MRI protocols. For the gap filled by this study by An et al. Has been alluded to throughout the presentation, but wanted to make it very clear here that the ultimate goal of the study was to consider what was done before. And before this study, LI-RADS 5 criteria had not been validated for diagnosing HCC or hepatocellular carcinoma in patients with non-cirrhotic chronic hepatitis C or CHC, despite a known risk. And this brings into question, how could we develop this? And so the study really looked into evaluating LR5 using CT and MRI diagnostic performance in this rather underrepresented population. And ultimately, the study compared diagnostic accuracy between these two populations, as mentioned earlier, and this leveraged a large multi-center retrospective cohort with standardized fibrosis using the fibrosis staging, Medivir, and then using consistent imaging protocols that can help us apply this to other populations, hopefully in the future, which we will develop and discuss more at the end of this presentation. And this ultimately supports the possible use of LI-RADS 5 and LI-RADS in general for non-invasive HCC diagnosis in non-cirrhotic CHC patients, and ultimately this can potentially reduce reliance on invasive biopsy or biopsy in general in patient populations that may opt to defer biopsy, or the materials and logistics of biopsies are not feasible. For the main takeaways and future implications, one of the key findings was that LI-RADS 5 demonstrated high diagnostic accuracy for detecting HCC in patients with non-cirrhotic chronic or cured HCV infection. And this ultimately indicates that non-cirrhotic CHC patients could be appropriate candidates for imaging-based HCC diagnosis without biopsy. Taking these key findings into account, the future implications include supporting potential expansion of LI-RADS criteria to include non-cirrhotic HCV populations. This further conveys how validation studies should standardize imaging-based diagnosis in this group. This is particularly valuable when biopsy is not feasible due to patient risk, patients opting to defer biopsy, or logistical limitations of conducting a biopsy in a particular clinical scenario. While this study was significant, it was a retrospective cohort, so this brings into question of how a prospective study may differ in the findings and are necessary to further develop the takeaways and hopeful future implications in helping us understand the role of LI-RADS in shaping other diagnoses. Thank you to An et al. For introducing an interesting, innovative, and exciting topic within the field of gastrointestinal radiology. I really enjoyed this paper and appreciate all the authors listed here that we have cited for this paper. Thank you to the Academy of Online Radiology Education for this opportunity to learn and explain some of the findings of a great paper. I am grateful for anyone that has listened and has contributed to the development of this. I look forward to learning more about the gastrointestinal system through the lens of radiology as well as other papers. I hope you learned something, and I look forward to seeing you next time. Thank you.